next surgery, a nose job. But the correct term, of course, is rhinoplasty. I want you to welcome back our plastic surgeon, Dr. Elie Levine, and our dermatologist, Dr. Jody Levine. Good to see you guys.
Great to be back.
All right, so, you know, oh, by the way, I should mention, Happy Father's Day.
You too.
How many kids?
4.
4. Okay, so 4 times I got 2. We're good. We're covered, all right? It's going to be a great weekend. All right, let's talk about rhinoplasties, right? A lot of people come to your office, want their nose fixed. What's the biggest complaint they have? Too big, too small, pointed the wrong way? What is it?
It's typically a combination of things. Typically the bump on their nose they may not like. They may have bumped their nose at some point and had some sort of accident. And then the tip of their nose, it may droop down, it may be a little wide. And each person has a different need.
Right, you think it's obvious, or is it usually just like a subtle thing and you're like, what? Or is it really something that's like, hey, this is a big problem?
There's such a variability with that.
I love that. I know people look in the mirror, they see one thing, right? That's all they see. All right, so is it mostly young people? Or do you find it's older people that find like, wow, I finally saved my money, I can get this done, I'm so excited to get it done?
There are a significant number of young people that are seeking out rhinoplasty nose surgeries, but there are also patients of all ages. It's the kind of thing that, like you said, they saved up their money. It's something they've been thinking about for years and years, and they finally got around to it.
Okay, I want to get right to your work because I think a lot of people are interested to see the before and after. So let's see if we can pop some of those up, take a look at them. All right, what do we have here?
So this is someone who had a rhinoplasty done as a teenager, and you can see that that edge of their nostril is really indented too much, and they really weren't happy with it. So I was able to fix that and put in a piece of cartilage to fix that so that it has a much more normal contour to it.
And that's kind of interesting because a lot of people don't realize that you can have a nose job, a bad nose job, and actually get it fixed later.
Absolutely.
Now, Jody, I mean, you also can kind of help with that, right? So as a guy with an indentation like that, maybe you could do something else to make that better that may not require surgery.
Exactly. I use fillers to do a sort of more of a camouflage job. We can fill in the nose so that you don't see a bump or so that you don't see a divot. I can actually even use Botox to lift the tip of the nose.
Right, so you can change the tip and make those little subtle differences. Of course, the difference with that is that it's not permanent and people would need subsequent treatments, right?
Exactly.
But for some people, that's an incredible option, right? Because they may not want the surgery.
And it keeps them out of the operating room.
It keeps them out of the operating room.
And there's no downtime.
And no downtime, there's another big one. All right, so let's look at another before and after. I think we have another one to take a look at. What do we have here?
This is someone who just wanted to refine her tip a little bit, and doing a small, very kind of subtle rhinoplasty, I was able to refine it and bring the tip in a little bit more, and she was thrilled with this.
Yeah, and to me what I like about it mostly is that it is so subtle. You wouldn't look at her and think, oh wow, look at that nose job, right? That's the kind of thing.
With these procedures, the objective is not for someone to look at someone and say, wow, what great plastic surgery. That's a disaster.
Right.
The goal is for someone to say, you look better, I can't put my finger on it, you just look better.
You just look better. All right, so there's another thing that people don't realize. So when and I'm going to go like a little hard here and do profile. So like people have a nose and they want their nose. They don't realize though, sometimes it's not the nose, it's the chin too. Talk about that relationship between the nose and the chin and why that's important.
There's such a unique relationship between the nose and the chin, and it's not uncommon for me to take someone who comes in specifically for a rhinoplasty and look at their pictures and do some morphing software and adjust their chin and not even touch their nose and say, what do you think of your nose? And they'll say, it's not perfect yet, but it looks a whole lot better. And then I'll explain, I haven't even touched their nose yet. All I've done is adjusted their chin. And you see this look in their eye like, wow, I didn't realize that.
All right, now Jody, you can also do some work with the chin as well, right?
Exactly. Fillers can help augment the chin as well.
So putting that together, I think what was so great about you guys being in partnership like that is like, you know, for people who don't necessarily want to jump the one way or the other, it works as a great combination. All right, so let's just talk about recovery because people may want to know, wow, you know, if I have this, it might be a lot of downtime. What are they looking at?
I would say about a week to 10 days. Sometimes it's a little bit less if they just have a little bump on their nose that are addressing, but if they're addressing a few different things, it's somewhere between a week to 10 days and they're back to society without anyone knowing they've had anything done.
Okay, we have some more images we want to take a look at. Let's see some of these other before and afters. What do we have here?
And this is someone who had 2 things, a little bump on their nose and their tip hung down a little bit too much, and I was able to elevate the tip a little bit and smooth out that dorsum, that nose.
Yeah, you could see that there was that little bump, and now it's going to, again, really, really subtle. And I think we have one more I just want to throw up real close, take a quick look at. What do we have there? Oh,
this
wow,
is
look
also,
at that.
you know, it's not just girls, it's also men seek out nasal surgery, and this is someone who had a bump on their nose and really wanted to eliminate it.
Right, that kind of looks like that classic hatchet nose, right, that people aren't talking, well, we're just saying it's what it is. We don't know who the guy is, so we're just pointing it out. All right, I want to talk about cost because a lot of people, obviously, Jody, if you do Botox and fillers, it's cosmetic, right? It's out of pocket. But there might be situations where someone gets a rhinoplasty where it could be covered by insurance, right?
Correct. There are certain aspects, if they have airway breathing problems, if their septum, which is a piece of cartilage inside side of their nose is off to one side or some other structural anomalies, oftentimes a proportion of it or a complete or the entire surgery can be covered by it. And also someone who may have had significant nasal trauma. They could play basketball when they were 15 or 16 and had some major damage done, and they may not realize it. They can get through life with everything, but all of a sudden they wake up 10 years later and they can't breathe that well, and these are also procedures that oftentimes are covered by their insurance.
All right, Dr. Elie Levine and Jody Levine, thanks so much for coming in. Really appreciate it.